Well, first, thank you for those congratulations. I wish I could take all the credit myself, but I won't. As you know, Dave, there is hundreds of people behind me that have supported this project, thousands that have supported this project from day one. And it's been a long time in the making. We've had to create some solutions for each of the counties that we serve first. But predicating all of that with the regional medical center was critically important. At the end of the day, I think what we've found is that we have community members and community leaders who support healthcare in their rural community and who want us to have the best that we can possibly provide. And they have stepped up in so many different ways to say that they want to be part of this project, part of this plan, part of this vision. There are a lot of people to thank, but I think people ask me all the time, what's different this time around? Did this time work? And why are we moving this forward this fast this time around? And I have to honestly say it's because of Dr. Mohan Suntha. He's the CEO for the University of Mayland Medical System. He's been in his role since December 1st of 2019. And from day one, he has worked hard with me and with our Shore leadership team to really meet the commitment that was made when Shore joined the University of Maryland Medical System. That's how long this commitment's been in place, since 2006, and actually even before 2006 when we merged. But he recognized as the new CEO that this vision, this strategy is an strategy. It's an vision.
Could you remind people about the rationale for this particular site?
Yeah, the site was really chosen many years ago, and it really reflected our need to be a regional healthcare system and be centrally located as much as we could within the town of Easton. I think those were the constraints. Within the town, centrally located, accessible to our community. And as you recall, we've done a number of these facilities throughout the Midshore that echo that. The Queen Anne's Emergency Center, right on Route 50, accessible for our Queen Anne's County community. The Cambridge freestanding medical facility that we just built in 2021, right on Route 50, accessible for our community. So we know it works, and we know it increases the access of our facilities to our community. So that's why I think centrally located right on 50 in the town of Easton was the ideal site that we're looking for. When the county came to us and said, we've got some land that we're willing to sell you, we took advantage of it. Also because it was 230 plus acres of land that we own now. So not only will this support the hospital and when it opens in 4 years, but it will also support other key healthcare services over time that will become the Shore Regional Health Medical Campus. When we look at this project, we don't just look at it from the eyes of a new hospital. We recognize that we can build the best hospital that the community could ever hope for, but if we don't have the workforce to support the hospital, it becomes very challenging to meet the community needs. So part of this process includes trying to bring more workforce to our community. And that includes providers, the nurse practitioners, the PAs, the physicians who are part of our care delivery system and are necessary for us to be able to do what we do. So in order to do that, it's a challenge to recruit doctors and nurses and techs to rural communities. We believe the new hospital will help, but we also know that the School of Medicine in Baltimore, the University of Baltimore, and the leadership there really have been at the forefront of helping us define how we can bring nurses, physicians to the Shore, let them experience their residency programs. Because what we found is that when they come to the Shore and they spend time doing their residencies, they stay. They love the area. They want to be here. Yeah. And then when you complement that with the new regional medical center, that's the home run that really will recruit those providers here. So, but it takes the School of Medicine in Baltimore, it takes the University of Baltimore and their leadership team to embrace this, and they have. And this has really become a multifaceted approach, not just a regional medical center, but an avenue for workforce as well. That's going to help us be a phenomenal organization in the future.
What I found fascinating about this, when I thought about the history, was the huge paradigm shift in how Maryland evaluated rural health needs. Somehow we had to make the case that we were, first of all, a rural hospital, and second of all, that criteria used for selection and for funding had to be changed.
Yeah. When I look at Shore Regional Health in the 5 counties, it's 2,000 square miles. of geography with only no more than 175,000 people. And what, comparatively speaking, our geography is the size of the state of Delaware. Or if you take our land mass and move it across the bay into the Western Shore, you're looking at a population north of 3 million people with hospitals within miles of each other. So I think making the case for us being rural was well received, but I think where the challenge that we were able to overcome was recognizing that we are limited with the resources that we have around us. So when you talk about ER visits or inpatient beds that you need, the averages just don't materialize because you can't go to another facility. There isn't anyone close enough to us to be able to offset those averages. You really needed to look at the peaks of utilization when you're trying to build the hospital in a rural community like ours. And that argument, I think, was accepted by the state agencies and others who realized that we are unique. There isn't a lot of resources around us, and we need a facility to support the highest levels of demands as we're experiencing that. And I think that resonated well. And I think that resulted in us being able to push the limit on the size of the facility that we've been able to.
Well, I can't imagine it's not going to be used as a model.
I sure hope so. I think when I look at Maryland and what Maryland is trying to do as a state, and then when I bring the plane down about what Maryland has been able to accomplish with the rural parts of our state, especially here on the Mid-Shore, I think it needs to be evaluated as a model for the rest of the country. At the University of Maryland, we believe that we aspire to be national thought leaders in what we do in healthcare, and creating a solution to rural healthcare that's going to hopefully stop the closures across the country, that's hopefully going to stop some of the reductions in services in these areas that need it most, could be the model that the rest of the country may be looking for. So I think with the governor's support, with our elected officials' support, and everybody that got behind this project and the state agencies that help us build this model together, I think we have a great story to tell. And I think it's not only helping us survive, but it's going to help us thrive for decades to come. So I think it could serve as the model for the rest of the country. The doors we expect to open sometime in the summer of 2028. So that's about 4 years from now. And I'm not sure who the first patient's going to be, but it will likely be all in one day. We'll relocate the patients that we have in this hospital over to the new facility, all in one day, transfer them safely into their new beds, and then close the hospital doors.